these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office, experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all, in-depth discussions.
Breaking it down into simple terms. We hold these truths.
We hold these truths.
With Dan Crenshaw.
The Eagle has landed.
Welcome back, folks. You may have seen these last couple weeks. I've been posting a lot on social media about what we're doing on the Energy and Commerce Committee to try and prevent children's hospitals from doing what is called gender affirming care, meaning giving minors under 18 puberty blockers, hormone therapies, and in the extreme cases, even surgical interventions for what I believe is an ideology towards she's trying to affirm a minor's belief that they are a different gender, when maybe psychotherapy would be a better option in a case like that. And it's a heated debate. You've might have seen me post some videos where I'm having that debate either with my Democrat colleagues or witnesses that have come up and stated that there's all these benefits to this, and where I'm just stupid. I'm just a bad person. I'm an evil person. I've been called, not called compassionate, but at the very least, but cruel. I was called cruel a lot, offensive, all of these things, which is strange because I think most people agree with me. I don't think this is actually a politicized, outside of Washington, I don't think this is a politicized issue. I think regular people have pretty strong opinions on that, and the polling suggests that most people think that this might be a bad idea. And we have had some kids go through this, and this is going to be really honestly, I think kind of a tough conversation to hear today, because you're going to hear from someone who's very brave, who went through this exact kind of experience. Chloe Cole. So Chloe, thanks for being on. I appreciate you being here and appreciate your bravery in speaking out.
Yeah, thank you for having me, and thank you for speaking on this issue as a legislator. To give a brief overview.
Yeah, please do. Go ahead.
Yeah. So I consider myself to be a detransitioner, meaning that I went through a gender transition for a few years. I socially transitioned, and I went through medically transitioning as well. And I decided after a few years to stop permanently. For me, it was because of regret, and because I realized that I wanted to have children of my own one day, and that it was causing more harm to me than it was doing any good. And I stopped transitioning at the age of 16. My entire transition spanned from the ages of 12 to 16. And I was 13 when I began medicalization. That was when I began puberty blockers and testosterone. And after my sophomore year of high school, when I was 15 going on 16, I underwent a double mastectomy, which was the permanent surgical removal of my breasts. And for about a year or so now, I've been speaking out about my experience having transitioned as a kid, the reality of transition, why it's never appropriate for children, and the fact that we need to have a better standard of care for these patients who have gender dysphoria or desire to transition.
And so that's important too. I mean, gender dysphoria is a real thing. We're accused of not believing in it, calling kids, of course it's a real thing. I mean, but it's by its very definition, a mental condition, right? You believe you're in a body that isn't yours. There's a lot of different types of dysphoria. Right. Anorexia is a form of dysphoria. Like, you believe your body is something that it isn't, and this manifests in gender and other ways as well. Of course, we believe it's real. I've got a lot of questions, I think, about just how this started. So, bring us back to that time in your life at age 12. I think most people would call you a kid at that point. You're a 12-year-old.
I was a kid.
And are you going through is there other attributing factors, in your life? Contributing. Right. I said attributing. Are there other contributing factors in your life? You're going through a hard time. I mean, how does this even begin? How does this conversation even begin?
There were quite a few, actually. From a pretty young age, I felt in a lot of ways that I couldn't really fit in with or relate to my peers. Throughout a lot of elementary and middle school, I was being bullied, and I had to move schools and neighborhoods, not because of the bullying, but it was a school year after I finally managed to make friends and fit in, and it felt like I feel like in a way it was sort of like a micro trauma because um, it kind of taught me that anything good that I have doesn't last forever, and that anything that I love can be taken from me. And I was back at square one in terms of socialization. Um, I was very internet oriented as a kid, especially after that move. Um, I that was also the school year that they started handing out tablets and laptops to all the students between the ages between grade levels. I think kindergarten up till like a senior year of high school,
Hmm.
and it made it so that there was constantly like a screen in my face, and I was pretty much always on the internet, both at school and at home, and
They allow
I
social
had some
media
attention.
on they give
Yeah.
you like a tablet and phone. They allow social media. There's no restrictions or anything.
At first there weren't any restrictions on these devices. It wasn't until like my junior year that they started like actually blocking websites
Hmm.
and restricting which apps students can use on these. So like students are like watching porn and browsing social media on these during class time.
Yeah.
Um, but as I got older, before I started to hit puberty, I started to become more boyish. I wanted to associate more with the boys at school than the girls.
Hmm.
I always felt like I had a sense of humor and a personality that aligned more with theirs, and I started to reject things that were feminine, like having longer hair, or um, it showed in the way that I dressed. Like I started to wear more like basketball shorts and
Yeah.
pants and things
Just
that were stereotypically, I guess you could
tomboy.
say
I know.
tomboyish,
Yeah,
which
tomboyish.
is a phase that a lot of women, a lot of girls and women go through.
Yeah, and how much is the current movement just I don't know, just taking advantage of or magnifying what is a regular tomboy transition? I mean, does that seem like what happened in hindsight? Is that often the case?
Yeah, I mean, a lot of it really is based on stereotypes. Like I as I went into puberty, um, I started becoming very, very conscious of my body and the way that I looked, especially because I started puberty so young. I was like 8 or 9 when it started, and I was just going to my fourth grade year when my breasts were starting to become visibly developed, and like my peers and sometimes even like teachers or adults would make comments on my body, and it was super incredibly uncomfortable to me. At the same time, like I started developing a little bit of muscle. Like my hips weren't particularly developed, and neither was my chest because I was just a kid. I was only a few years in puberty. And I felt like I couldn't match up to these images that I was seeing like on social media or online. And I felt like in a lot of ways I would never make a good woman because I thought I wasn't pretty enough. I thought that in terms of like my personality, myself as a person, that I wasn't feminine enough, that I didn't want to have kids just because I thought like things like childbirth and pregnancy were so scary, and because I was a kid, like
Yeah,
I no kid is really wanting to become a parent, but
right.
I
What
thought
about
that I didn't even know what it meant to feel like a woman.
this is 6 years ago. So um God, I mean, this is like right before I even got involved in politics, actually. So
Hmm.
I'm not sure I have a keen awareness of how prevalent this, I would call it a movement, was, right, to just kind of gender affirmation care movement was back then. Obviously it existed,
Yeah.
but I don't think it was like it is now. But it obviously was enough. And so when you're on social media at age 12, are you seeing a lot of are you feeling any kind of peer pressure? Are you seeing the sort of transgender movement out there a lot on social media, normalized as like an option for someone who's feeling the way you do, which is, by the way, how most teenage girls feel, right? It's how everybody has gone through these sort of these kind of feelings through puberty. Obviously there's different degrees of it. um, was that kind of pressure there on social media? Maybe not pressure, but even knowledge.
Yeah. I mean, I'd say like 2013 to 2017, 18-ish is when the transgender movement was really, really starting to pick up on
Hmm.
online and through social media and in media in general. And that's mainly where the influence is coming from, actually. I never really learned about it from school or from friends
Yeah.
or from family or anything like that. It was entirely online, and just the influence, the knowledge of it alone was enough to make me want to
It gives you an
pursue
option, right?
transition.
Like it
Right.
gives you an option because you're like, okay, I feel bad. I shouldn't feel bad because nobody wants to feel that way, and nobody's telling you maybe, okay, this is normal, whatever you're feeling. That there's a lot of reasons for it, and then you see this option, in the depths of the internet, and you're like, well, that could be it. That could be an answer, and it kind of spirals from there. And so, how did you? So, what was the next step? I guess going back to the details of your story. Did you go talk to a therapist? Do you talk to your parents? Like, how does this go?
Yeah, so after a while of just being exposed to this kind of content, and I mean, it was presented in a very cheery way. I first discovered the transgender community through communities online that were very much, it was focused on stuff that was seemingly unrelated. Like it was about like video games and shows I liked and comics and anime. But a lot of the users in them were like young women who identified as transgender or as non-binary. And I started seeing posts eventually that were um, specifically about like the LGBT community and like things like all the different sexualities and gender identities. And it was really interesting to me at that time for quite a few reasons. I mean, I was like 11, 12-ish when I was
Yeah.
seeing all this. And so I was at an age where like I'm a few years into puberty, like my mind and my identity are starting to expand. And I kind of want to explore what my role in the world is. Um, and this gave me a way to do that. All these new words and flags, and it seemed so happy the way that everybody talked about
Hmm.
it. It was all about like discovering yourself and finding your community and learning to accept yourself and the people around you learning to accept you. And I mean, as somebody who had been bullied throughout a lot of my life, it really, in that sense, it really spoke to me.
Yeah.
And like I said, like I didn't necessarily relate to women, the other women and girls around me in a lot of ways. And so I started to question whether I really even was a female. And after a while, I I decided that
Yeah.
there's no
Well, and
way that
who's
I'm a girl. It doesn't make sense.
and who's the first person you talked to about that?
Um, well, I talked to a few friends in person about it. I was in like seventh, eighth grade at the time when I started to socially transition,
Yeah.
and most of them actually took pretty negatively to and I attribute that mostly just to the fact that we were all in middle school, so we're at that age, we're not necessarily all nice to each other.
Yeah. I
Um,
remember. Yeah. I
yeah,
remember we
but
all do.
then
Right.
after a while of just like slowly, silently trying to socially transition, changing the way that I was presenting myself, like through my clothing and stuff, and just
Hmm.
trying to get comfortable in my transition, I decided like I would come out to my older sister and then my parents through a letter. I left after I told my sister about it. Like she was pretty supportive of me, and then I decided that I'd write on a note to my mom and dad, just basically telling them that I don't want to be a girl. I want to be their son and
Hmm.
not their daughter anymore. And my preferred name and stuff, and just that I hope that they would be accepting of me and that they would love me the same. Um,
And so
and
it
I was
sounds
also
sounds like sounds like they were.
yeah,
It's
they
right
were, but
because they.
I was very nervous as to how they would react to this. I didn't know how they would respond because I mean I knew they would still love me after the fact, obviously, and that they I was just worried because like I would see posts online about how like people would like get kicked out of their homes by their families and how they'd be abused
Yeah.
by their families after coming out to them. And I knew like my mom and dad loved me and that they would never do anything to that, but it still kind of added to that tension. But once they like read it and we were ready to have that discussion face to face, I mean, they were pretty supportive as well, and they wanted to accommodate me and make me feel comfortable and use my preferred name and such, but they're also kind of concerned about like where this was coming from and what was making me feel this way. Because like I'm the youngest of 5 kids, right?
Yeah.
And my parents had never heard anything like this from any of my siblings, so it was totally new to them. They knew absolutely nothing about this. And I feel like it could have just been if we just like sat down and had like a discussion about like how I felt about myself and what was like where the influence was coming from that was making me feel like I could opt out of being a woman, and where these what made me feel like I wasn't one. They probably would have just realized that it was just, I mean, they knew like it was having to do with my mental health, but
Yeah.
like they would probably would have seen that like we don't have to, it's not really a clinical issue.
Right.
It's just
They're
her
adults.
being
They're adults, and
creative,
they might have
autistic,
like
and a
thought of
tomboy.
other reasons. Yeah. I mean,
Yeah, but
well, do you? I mean,
the
what's your
response,
relationship? Is your relationship still good with your parents?
yeah. I mean, it
Yeah.
was pretty strained for a bit as I was going through the motions of transition and going through the stress of it all, but it's actually a lot better than it's ever been.
I mean, the question I have is because okay, so that from that first conversation, or it sounds like there wasn't really a conversation. It was more of a letter, and then you guys kind of everybody sort of froze it in place. Like, what do we do now? And but it
Yeah.
obviously escalated from there because I mean, it's one thing to say, okay, I'm a boy. That's one thing. It's quite another to say you need to take me to the doctor, and I need to start taking therapies to, physically alter me.
I
And
mean, I didn't
so,
start with that, but
no, of
there,
course not. But I mean, how does it?
yeah.
I'm kind of curious, and I think maybe a lot of parents might be curious as how it gets to that point. I mean, because you're an advocate for not getting to that point right now. So, right. I mean, and so it's I think that's why your story is so helpful. And so, so you have a good relationship with your parents. They're supportive. They don't know much about it. I mean, how does it go from there, from that social transition to a medical transition?
I mean, their immediate response was to start sending me to a therapist just because, like, they were worried that they didn't know what move to make, basically,
Mm-hmm.
whether to
Yeah.
like obviously they wanted to make me feel comfortable with myself, but they didn't know like whether to say yes or maybe like wait until I was an adult. They were
Yeah.
kind of leaning towards that. They wanted me to wait until I was at the very least like 18 years old to
Yeah.
make a decision that could be permanent and
So
effective for
they
the
made
rest of my life,
the
of
rational
course.
that's a pretty rational
Right.
decision. They could go to therapy.
And their expectation wasn't that they would just immediately affirm right away and that they would tell me that I was actually a boy because that was the way that I felt, or that they would pressure them into going along with it. Like
Yeah.
their expectation was that,
So that's what happened.
yeah, they thought that it was
Wow.
they're just gonna like help me learn to cope with these feelings that I had, maybe figure out where it was coming from, which they never did. I mean, they did like a psychological evaluation during my diagnosis for gender dysphoria, and they knew that I had other pre-existing issues, like I was previously diagnosed with ADHD. It was very likely an erroneous diagnosis, though, and I'm pretty sure that I'm actually on the spectrum. But I just, every time I tried to get diagnosed with autism, they just tell me like that I'm basically too smart to be on the spectrum, which is
That's how I feel too, no, it's so you got pre-existing conditions, and who
right.
is they? I mean, is like a school therapist, or is it just they just kind of
Um,
found whatever therapist is in the network, a healthcare provider? The point is it
yeah,
was a
through my healthcare
therapist.
provider, it was a pediatric therapist, and then once that first therapist was actually pretty lousy. Like he did absolutely nothing. He knew like I was having some issues like at home, at school, and he didn't
Yeah.
really do anything about it. Like we would just talk about it, and he'd be like, "Oh, okay, that's kind of weird," and not like teach me any way of like how to cope with
Okay.
the stress that I was having around these things. And I actually started to get pretty frustrated at the time. I even told my parents, like, I'm not satisfied with this therapist, like, nothing's happening. And, like, it made me more and more distressed. And I wanted to actually go through the motions of transitioning because I thought that it was the only option that I had. Um,
And so
and my parents naturally
this
were starting to
first
get pretty concerned. So after I was diagnosed with gender dysphoria by, I believe, the gender specialist, they sat down with my with these doctors, and they were saying like we're kind of we're worried because she's pushing so much for these treatments, and
Mhm.
like she's just a kid. We want her to wait until she's an adult, till she makes any permanent decisions around her body. And we don't know much about this. Like we don't know what's going on with her. Like you guys are not having discussions like with us about the appointments
Yeah,
that she's having. Like they would have them outside the room for those appointments, so they wouldn't hear about what was being discussed, which
right.
honestly was absolutely nothing. That was the problem. And like they asked, what are the chances that she's going to regret this? All very reasonable questions,
Yeah.
and they were shot down pretty much immediately. They were
Was
told like,
shot down by the therapist. And I know these are kind of detailed questions, but I'm always curious, like where the point of failure is. Is it sounds like the therapist just didn't, kind of lazy, just maybe not that well qualified, maybe new, maybe not that experienced, didn't do a lot. So it wasn't the
yeah,
therapist pushing you towards this. It was more you had other appointments. You had other appointments with a gender. I don't know what a gender specialist is. Is that like I don't know what kind of doctor that would be.
it's
Is that like a psycho? Is that a
so
therapist or?
yeah, I think I'm not exactly sure what the title encompasses. I've heard that it's just I think it's like a just like a child like a
They're
psychologist
a psychologist.
who is
Okay.
qualified to who's trained in
Right.
dealing with gender dysphoria. And in my case, the gender specialists that I had throughout the years just referred me between services
Yeah.
like hormones and surgery and such.
So that was different than the initial therapist you see, right?
Yeah.
So
And I
you
went
saw
through
this.
several therapists over the years.
Okay. But there was obviously there seems like there's like one in particular who, once you're in their care, they're like, well, that's that. We're doing the affirmation kind of therapy, right? No questions asked. Is that
Yeah.
sort of I understand it
And I
correctly?
mean, that was the approach that they took immediately. Like as soon as I sat down with the therapist, it was like, as soon as gender was brought up, it was like, oh, well, what's your legal name? What's your preferred name? What do you identify as? What pronouns do you want us to use for you?
As opposed to like, why do you feel this way? As opposed to just asking
Yeah,
an open-ended, let's start with that. Like, why?
right.
What else is going on here? And so I mean, this is what's I don't know why this became so normalized, but it's and it's very similar to anorexia. Like it's you're it's obviously not normal. It doesn't mean it's wrong. There's a difference between not normal and wrong. I'm accused all the time of vilifying people. No, there are adults who it is certainly possible to be very happy doing this. It's possible, but we're seeing more and more people like you come out and say, look, you've kind of been bullied into silence, right? If it does go wrong, by a very active movement, and it's not all sunshine and rainbows. I mean, this is
Right.
extreme. These are extreme procedures. Um, it sounds like you didn't go through the most extreme of procedures that can happen. I mean, there's some serious. I've had some folks on my podcast that are very, very extreme medical conditions now because of entire surgical interventions that are quite drastic. It can get a lot worse. It sounds like your regret started, at least caught it earlier. But God, a
Luckily,
12-year-old
yeah.
girl, but like a 12-year-old girl, and I'm accused too of saying I'm told all the time, well, this doesn't happen. Why are you guys fighting this fake culture war? Like it doesn't happen to children. I'm like, yeah, even if it happens once, by the way, I think that should be a red
That's too
alarm.
many.
And
Right.
and so even back then, and that's what's so crazy. So even in it's around 2017, 2018, right?
Yeah.
Even back then, the medical community that you're dealing with, this is in Central California.
Yeah.
Yeah. Is in this sort of affirmation model, right? Not a psychotherapy model, but an affirmation model. And that's just mind blowing, and back then there was, I don't even know what studies they were relying on, what kind of standards of care they were relying on. I mean, they say words like standards of care, but the standards of care by definition means evidence-based medicine. And there has to be some pretty serious evidence if you're going to put children on some of these therapies. So what was going back to your story though? I mean, okay, so what's next? So you've done the research yourself, right? You're a kid who's done this,
Yeah.
you've been on the internet, you kind of, like you said, you've been looking into the community and all that, and you're asking for things, and they're just like, absolutely, that's exactly what you need. And so how did it start? Is it puberty blockers is how it starts?
Yeah, that was the very first intervention that I was put on. And that was when I was 13 years old, about halfway through my eighth grade year.
And how, walk us through that. What does it feel like? I mean, when do you first start noticing effects?
It was awful.
Really?
Because I was already a few years, like maybe like 3 or 4 years into puberty by that point. So, because it was like the way that puberty blockers work is that they block the production of sex hormones by the body. And so I was basically put into a state of artificially induced menopause. And I actually started to experience menopause like symptoms like hot flashes,
Really?
full body itching, um, and sometimes, I mean, I would wake up every day just wishing for the next big thing, which was testosterone, because I wanted it to stop. Like I was super low energy, very lethargic throughout the day. Um, and it made it kind of difficult to like focus in school and on my studies. And
And what happened
uh,
when you tell your therapist this, like, hey, these are some pretty bad side effects. I don't like this. What is their
I,
response at the time?
I actually didn't really talk to anybody about it because it was like it was so normal to me. Like I saw
You
all of this. I was just part of the process. Like I was told
yeah.
about it. Like
Okay.
I thought that this was
You,
necessary for my health and becoming like whole as a person.
yeah. Yeah. Okay. So you'd done the research. You knew those side effects were coming.
Right.
Um, and yeah, you thought it was a means to an end, right? A means to like a better end.
Right. But I was experiencing things that women usually start to go through like towards like their late 40s to
Right.
like early 50s when I was just a little middle schooler.
And and so how long after those initial treatments do you start testosterone?
Um, I mean, it's hard to get the timeline right just because like it was so long ago.
Yeah.
But it
So
was like
six.
I think it was like roughly like a month or so.
Oh, okay. So very soon, very soon
Yeah, it
after.
was pretty soon.
So puberty blockers have
Um,
that effect right away. I mean, you feel it right away.
yeah, about like 2 to 3 weeks afterward, is
Yeah.
when like I really started to notice like hot flashes coming in, like my libido and my energy levels have totally dropped. And it actually forces a period in females who take it, just because like a drop in estrogen, I think is what causes periods in the first place. And it was extremely heavy and painful.
Yeah.
And it kind of pushed me towards transitioning in a way because like it's a
Like
period, like I'm
now
already
you're on
pretty
the track.
depressed around that kind of thing. And now it's like I don't want to experience it ever again. Like it's just it was humiliating for me.
And then you go on to did things improve when you're on testosterone? Did you at some point feel like, okay, this is good for me, or how, like, I'm trying to get a kind of a picture of your mental state, and then what eventually made you decide to detransition?
Yeah, I was basically counting on the days until I could start on testosterone. And once I had my first shot, like before the effects even started to come in, I was super excited just because like I saw it as like a huge step in my life. I was really looking forward to the effects of it and in my mind becoming like my truest self, becoming a
Yeah.
real boy. And once the effects started to come in, which started pretty soon actually, it's a very powerful substance.
Yeah.
And I'm a biological female on a very high dose of it. Um, I think like the psychological effects came right away. Like I had my energy levels back finally after being deprived of sex hormones for a little bit,
Yeah.
and my libido shot up. Obviously, um, I started to become more confident with myself, even a little bit more competitive. And then the first physical effects started to roll around maybe like a few weeks afterward, like 2, 3-ish weeks when my voice started to drop. And it was very dramatic. Um, like
What was it like at
by
school?
the time,
What was it
yeah,
like with
I
your
hadn't
peers?
really,
I mean,
yeah, but my peers, most of them I hadn't really come out to by this point. So it was kind of a big shock to them. All of a sudden, like hearing my voice get super low within like a month. And
Hmm.
then like seeing like my face and body start to change, that was pretty weird for them. And like I'm already getting bullied because I'm just
Yeah.
because we're all like 13, 14-ish. We're not very nice. And
Yeah. Yeah.
like kids who are different anyway, like get get bullied, unfortunately. And
Yeah.
it kind of made it a little bit worse for a while. But I feel like the bullying that I experienced at the time just kind of pushed me further into it because I so badly wanted to prove these people wrong that one day I would look and sound and be just like any other man. Um, but a few months after I started testosterone uh, was when I experienced my first sexual assault. Um, it was by a boy who had been bullying me throughout the year after I started transitioning, and one day he went too far. He came up to me in a classroom before school, um, and he looked me in the eyes and he squeezed one of my breasts, and then he left afterward. And in that moment, it was so bizarre because like the room was full. There were a bunch of other kids, and even the teacher was there, and nobody either seemed to notice or care. And in a lot of ways, it was pretty traumatic just because like I mean, I had a part of my body um
Yeah.
compromised.
Right.
And it's part of my body that I'm already very conscious about, and I'm in the mindset of like, well, I want to be a boy, so I don't want to be visibly feminine at all. And that was kind of
Right.
like the nail in the coffin to
Really.
me deciding that I would finally hide my breasts. I started using a device called a binder afterward to it's basically a compression
Yeah.
device, like in the shape of
Yeah.
either like a tank top or like a sports bra, and it's
Right.
used by men with gynecomastia or like women who cross dress or want to transition to male to flatten the appearance of the breasts.
Right.
Um, I started doing it pretty much right after that happened, and like I had my trust in pretty much everybody around me broken because I remember girls at school telling me like, "Oh yeah, he's kind of mean, but like he's not actually going to hurt you. He's never going to lay a hand on you." And I
Yeah.
trusted their judgment. And I felt like I couldn't tell anybody about it because not only because of that, but also because I couldn't trust the adults around me to do anything about it. Like I could have told my mom and dad about it, but I mean I didn't want to see them upset. I knew it would make them very upset, and I didn't want to put that kind of stress on them. And I was afraid to tell anybody, any school staff or teachers about it because I knew it would probably be a big fight that I might not win. I mean,
Yeah.
like it's not like there's any proof. It's not like he left any marks on me. So how can I prove
Right.
it? And even then,
Especially at that age,
even if they believed
it's a
me,
big deal. It's a big deal.
right? Even if they believed me, they probably just would have given the kid a slap on the wrist, and he could have come to school after like a detention or like a several day suspension and potentially do worse
Right.
because like schools in general just don't really take the proper measures to do anything about sexual assault.
Yeah.
And so I was in a position where I felt like I couldn't fight back, and it made it so that I couldn't properly process what happened to me. And
Right.
unfortunately, that was part of that trauma around my chest was part of what led me to eventually getting a mastectomy, even if I didn't really realize at the time that I wanted to escape being a woman because I was afraid of being abused like that again.
Yeah. And so that, like you said, that was the final nail in the coffin, and that kind of led you down the path to the surgical intervention. Is vasectomy the only surgical intervention you had?
Yeah, it's the only surgery that I had.
And that came how long after that? And what was that conversation like with your parents? And I mean, and I'm also curious how I mean, again, you're dealing with a so-called gender specialist, and you mentioned this before that they kind of bullied your parents too.
They
Uh,
did.
yeah, and
They absolutely did.
how was that? I mean, like, in what way? Tell me more about that.
I mean, every single one of their concerns was dismissed, like why I was pushing for this so much, why I wanted to do this so badly, why I couldn't wait. and what the chances were that I would regret this. My parents were
Mm-hmm.
very sensible, and their concerns were dismissed immediately. They were told that they're basically emotionally manipulated. They were told, like, well, like, none of your other kids was pushing for this. There's a reason why she wants this so bad, and it's pretty obvious that this is going to benefit her. It's very unlikely that she's going to regret this. It's really about less than like 1 or 2% regret rate.
Yeah.
And if you don't affirm her in her identity and her decision to transition, you're probably going to have a dead daughter rather than a living transgender son. So it's your choice.
Given that you're pretty outspoken about this now, you're probably familiar with the studies as I'm familiar with the studies. And they use that 1 or 2% regret rate often. And now they're basing that off studies that are very manipulated. They take a very specific pool of people. And by the way, not even children. Like we're not even, it's adults usually that are in these studies, not children.
Right.
And there's a couple of problems with them. One, they wouldn't even let people into that the pool of applicants if they detransition. So by
right,
it's there's you could kind of take the analogy of like, well, do all AT&T cell phone users like their service, but we won't ask anyone who's changed to Verizon, like we won't, right?
That's very accurate, actually.
Yeah, I mean, that's kind of the analogy they use. And I think they only did like a 1 year, 2 year sort of long-term study, and they're just surveys. They're not studies.
That is not nearly enough.
Right. And especially when you're talking about, I don't know, 20 years from, 20 years from then, having kids and things like that. So, no, there's not enough at all, but they use that statistic like it's science, but these aren't clinical trials. These aren't double-blind randomized clinical trials at all. No. They just say it like it's real.
It's all self-reported data, which is notorious for being unreliable.
Yeah.
And they're also the ones who are fooling these patients into believing that it's good for them and not giving them the full picture of what this really means for them.
Right.
It's really affirming nothing more than a delusion.
You're hearing from a doctor that there's a 1% chance that you'll regret this.
I wasn't even in the room when they were talking about that. I can't imagine how I would have felt if I heard from my own doctor that my parents' decision not to allow me to transition could kill me. I wasn't suicidal at the time either. Like there was absolutely no risk that I would commit suicide. I was a pretty happy kid at the time.
Right.
And I wasn't suicidal or depressed until I was on these treatments.
Really? Oh, well, talk to me about that. So we haven't talked about that. So afterwards, it got worse. But the bullying, obviously, is a contributing factor to this. But do you think also just the fact that these medications are messing with your hormones, it's going to make you, so you were depressed after that? Talk to me about your mental state.
Yeah. Once I got into high school, like I was on hormones for a little bit, so I pretty much passed as pretty much any other young guy my age.
Yeah. You
cut your hair. I was a little bit short, like 5 foot. I'm like 5'3", 5'4" But at the time, like we're all freshmen, so that was pretty standard, really.
Yeah.
There's quite a bit of deviation in height, anyways. But yeah. I had a deeper voice than a lot of my peers throughout most of high school. And like I had like a very defined facial features, and I already naturally had like bigger shoulders.
Mm-hmm.
So pretty much everybody knew me as a boy. Most people at school didn't know that I was biologically female, other than some people who I went to like elementary and middle school with, and some people who I was like outed to behind my back a few times. Yeah. But other than that, like everybody knew me as a boy.
Oh wow! So okay, so that's and did you? How did you use boys' bathrooms? Like how did that work? Yeah.
Yeah. So I used male facilities and everything because like I mean I knew like I would make girls uncomfortable in the bathroom if I went in there.
Because they all thought you were actually a boy, really.
Yeah. And there was actually quite an element of stress to that, just because like I still knew deep down that I was a biological female and that I was potentially putting myself in a pretty risky situation. Because like if somebody knew that I am still biologically female, that I have like all my parts intact, and if I'm caught in there alone during like class time or something, it could be dangerous.
Yeah.
I very much had a fear of like being assaulted and it wasn't really out of the it wasn't really not a possibility that it could happen, and
Yeah.
unfortunately it never did. Um,
Well, especially
so
given your
I had that
previous
sort of
experience.
stress. Yeah,
Yeah.
I had that sort of stress on me pretty much every day for a little bit until I got used to it. Um, and like for a while, like there were like girls who had crushes on me, and it kind of was a bit of a confidence booster. But after a while, it just became kind of annoying because,
Were
I
you
mean,
attracted to girls? I mean, because one of the things, what the real data actually shows is that a lot of kids who have gender dysphoria are eventually just gay or lesbian. That's they kind of work it out, and that's really what's happening. We've all grown up with these people. Like, this is why I hate being
mm,
accused of being cruel. Like, I'm not that old. This isn't. The LGBT community is not some crazy community to me. I'm not that old. Like, we've all lived with it throughout our entire lives. But that's usually what happens. The
yeah.
transitioning to a different gender is a very new thing. So, what was it like for you?
I mean, I consider myself to be mostly straight. I mean, I've always had like a very marginal attraction to women, and it's mostly physical. So I wasn't really interested just because like I didn't know if I would actually be interested in a relationship with
Hmm.
these girls, and I also knew that even if I was, like, I know I don't have exactly what they're looking for. I'm not actually a boy, and I don't want to either like break their hearts or disappoint them. So I kind of just shied away from that, and I'm mostly attracted to men, and obviously because I look like a boy, um,
Yeah.
most men and most women are heterosexual, and so I already had like a very limited dating pool. And on top of that, I'm not actually a biological male,
Yeah.
and it became kind of depressing after a while, just because like I was watching most of my peers like starting to mingle with the opposite sex and get into relationships and get their first boyfriends and girlfriends, and I was totally missing out. And
Yeah.
I felt like it was really embarrassing for me.
Yeah.
And
And that's what led to I think that's what led to depression and the
yeah,
sort of darker
that's a
thoughts.
big
Yeah.
part of it. But also just like the fact that women aren't really built for the responsibility that is male socialization.
Yeah.
Um, I started to realize this over time, and it it was kind of lonely in a lot of ways because when, at least in my experience, when you're perceived as a boy, um, you don't really have as much room to talk about things that you're going through personally, like your own personal struggles or like
Oh, it's
your feelings
entirely
around
different.
things.
It's
Right.
entirely different. I mean, it's like exactly like you just said. It's a very different type of socialization and development. Boys' locker room versus girls' locker room. I mean, it's especially in high school, but honestly, forever. We talk about different things. We have different outlooks on things,
Right.
and you're kind of stuck. You're stuck in the middle of it in a way, in this sort of no man's land, if you will.
Yeah.
Um, it can't be fun, especially in high school.
No.
Um, and so so at what point in high school did you actually at what point did you decide, okay, I'm going to go through with this with an actual surgical intervention to make this real?
About halfway through my sophomore year was when I told my therapist that I was thinking about getting surgery, and then I was referred to another gender specialist who did like a an evaluation that was really nothing more than like, oh, like how many years have you been on testosterone, or like what do you identify as, like what procedures do you want, and that was it. Like after just an appointment or two, like I was referred to a surgeon, and then I guess my motivations in getting the surgery were that, well, obviously because like I thought of myself as a boy and I looked
Mm-hmm.
like one, but I still had this one thing left that I was very conscious of. And I have to wear this stupid binder every day. That's super
Yeah.
uncomfortable, especially when it gets super hot here.
Yeah.
Um, and like in the early fall, late spring, and throughout most of summer, it gets super hot. Like
Yeah.
at the worst, recently it's been like 110 degrees, And I would work out, I would swim, I would walk home in this thing, and I hated it so much. Like I wanted to be done with it, and I
Were you a
wanted to be free
swimmer?
of it. I wanted to look like
Did you swim
I want,
competitively during this time, or
no, it was mostly just like for PE
okay?
and
Yeah,
at home. But
yeah,
like I just wanted to be like any other boy, really.
yeah. Um, okay, so and you get the surgery, and I mean, how did you feel afterwards? I mean, was there at least some initial kind of positivity from it, or
Oh yeah.
and then at what point did you start thinking, okay, this is not the right thing?
Um, like the initial month or so afterward, I was pretty happy about it actually. When I woke up from the surgery, um, and like I was fully conscious, all the medication had worn off, and like I realized what just happened. I was really excited, and I was ready to go home and be fully finally be fully healed after the fact, which I knew would take maybe like a year or so. But I
Yeah,
was super looking forward to it, and again, it was like another big step for me, quite like the testosterone was. And when I posted about it online, my friends, some of them were from school, many of them were people who I'd met in online circles, had celebrated this for me. And it was probably like the most praise I'd ever gotten in my life up until that point. Because like I guess like the greatest compliments I'd ever gotten before that were like from teachers or other students or like my mom and dad on like my artwork or something stupid like that. But this was something I'd never really seen before,
hmm.
and it was incredible. And
Well, that's the other strange thing about this movement is that there's definitely a pressure on younger kids to celebrate it, which is like, I mean, your friends are your friends, so on the one
right,
hand that's great, but on the other hand, part of being a friend is, I think, telling someone, I don't think this is a great idea.
yeah,
And and so I think our entire society is at that strange tipping point where there's a big difference between telling someone what you think they want to hear, and telling someone what might be helpful to them, and what might be helpful to some people is can be quite different. um and me growing up, again, I'm not that old, but I guess much older than you. This just wasn't really a conversation. We didn't have this movement. It wasn't a thing. There was of course, gay and lesbian classmates, not a big deal. But not this. And so I don't know how we would have reacted, to be honest, because we just never even had it. It wasn't a thing back then. I graduated high school in 2002. But now it's quite different. Right now it's highly normalized. Like you said, you found out about it from the internet, which means every one of your peers has the same access to that kind of information. This movement sort of started in 2013, as you stated. um do you What do your friends think now? I mean, are the same people who applauded you back then for doing it, and now seeing how you've detransitioned and are pretty a vocal opponent against doing it, how, what are those conversations like now?
it's pretty varied. It kind of depends by age group mostly. Like a lot of people I was friends with throughout school who were like maybe like a few years older than me often tell me that like they wish that they had spoken up before, but they felt like they couldn't because they were afraid of losing me, or that their concerns wouldn't be heard out, but or that they'd be like criticized by other people around us for saying anything even remotely negative about it. There is a huge pressure not to voice your concerns, especially around this now, amongst young people. Um, I my old friends within like my grade, their responses are pretty varied. Some of them are really proud of me for getting through it and speaking up. Some of my old friends saw what the problem was, that transition was only making me into a worse person, and they weren't really exactly sure what to do or say about it. I have some friends who I guess you could say are super woke, and so they're totally bought into the ideology. They look down on me, of course, for just talking about my experience and the fact that this shouldn't happen to kids at all. I have a friend from high school actually, who started socially transitioning a few years after I did, and we're not on good terms right now, unfortunately. Um, she started testosterone some time ago. I'm not really sure when because she hasn't spoken to me in a very long time. But she's upset at me for talking about this and in opposition to it. And uh,
Yeah, I mean, it's
it kind of sucks because I really feel for her, and everybody in our friend group can see that she is in the exact same situation that I was, but even worse. And there's not really any getting her out of it, unfortunately. But I mean,
well,
I
what
just
got
hope
you
that
out
one
of
day
it?
she'll be able to see the truth and to accept not only the way that she was born, but that the fact that she deserves better, you know.
Which is
But
at
what
least
got me out
deserves
of it,
at least deserves the power of knowledge, and that's the thing.
yeah,
That's what makes me so upset about the counter arguments against what I'm doing, and just for the audience listening who hasn't heard what I've been up to. um all we're doing at the federal level on this subject right now, the only thing we're doing is we're tying funding for children's hospitals graduate medical expenses, or they're called graduate medical programs, which means basically funding for residences at children's hospitals. We're saying, look, if you're going to take this federal money, you can't be doing gender affirmation care, and that includes puberty blockers, hormone therapy, and surgical interventions, and that's it. It's not making it illegal. It's just saying vast majority of the population of taxpayers are against this, so taxpayer money shouldn't be used for it. Now, look, do I think it should be illegal? I absolutely do. In Texas, it is illegal now. That's a new law just passed. So I do agree with that. I'm not so sure that's a federal law that should be passed, but that gets into a whole kind of political philosophy of federalism. But morally, no, I think it's wrong. And our first step, and why I'm so glad we had all these hearings and expert witnesses, especially expert witnesses from the other side of the argument, is because what is shown when you actually look at the data is that this is not the benefits of these therapies are not supported by the data. It's quite the opposite. The risks are extreme. And people, just giving people the knowledge should not be a controversial thing, which is really all you're doing. You're just like, look, this is my experience. Take it or leave it, but this is the experience, and you should also look into the science of it a little bit more. So what was that moment for you? I mean, because you were happier after the mastectomy. At what point did it change?
it was very much a slow burn, I would say. Um, the recovery process was, uh, it's brutal to say the least.
Yeah.
They used skin grafts as part of my mastectomy. They basically like took off the areolas and repositioned them into a more masculine positioning, they said.
Yeah.
Um, and I mean, when they do that during while they're like grafting it and moving it, the skin on top dies.
Yeah.
So it was really hard to look down, and like every shower, every bath I would take, I would have to like take off my dressings and redo them afterward. And then I have to look down and in the mirror at my chest, which looks like a total war zone, and like these black skin grafts and these big scars on my chest. And eventually the black skin renewed and became new healthy skin. But unfortunately, it hasn't fully healed.
Many years later.
Yeah, in the last year, I started having some serious complications with it. It's like weeping fluid, and I have to wear bandages every day again, even though I stopped having to do this, and I haven't got any help with it. But before
Wow.
that started happening, even I started to realize that I missed presenting myself femininely and having long hair and being able to wear makeup and skirts and things like that. And then I just kept going down this spiral of feeling like there's something wrong with myself and not being able to just live with myself. And it was hard to admit for the longest time that this was doing more harm than good to me because I was so deep into it. Like everybody around me knew me as a boy. I looked like one, I sounded like one, and now my body is changed permanently. So what could I even do about it? Is there even any way to go back?
Yeah.
And I learned that there was, and that I didn't have any other choice because uh, during my junior year, towards the end of the psychology course I took that year, um, it was very focused on like a childhood and adolescent psychological development, all the different stages, um, and the psychology that goes into parenting, um, how things like breastfeeding, physical affection, and such affect a child while they're an infant, and how it affects the course of their later development.
Yeah.
And this is all totally new information to me because I'm the youngest kid, right? I never really
Hmm.
had to like babysit or take care of a kid who was younger than me. So I never really got to like, I guess, like exercise any maternal instinct. So this I never even knew that one day I might want to have kids of my own up until that point. And I learned about this when I was learning about the things that go into it. And I was heartbroken because like I'm never going to be able to breastfeed without breast, obviously, and I was informed of this, but it didn't mean anything to me at the time that I had the surgery because, I was in the mindset of like, well, I'm gonna become a man. Men
Hmm.
don't breastfeed children. That's kind of weird, and
Hmm.
I don't really see any use for these things on me. But now it's like, wow, this is a lot more special than I realize, and everything. This was all a lie. I can't keep living like this because it's destroying me. It's destroying my body. And no matter what I do, I'm always going to be a woman. And I'm just going to be a woman with less parts of myself. And there's nothing that I can do.
What was there, during this time, were you considering more extreme surgical interventions as well? Or was it the experience obviously wasn't good, and so you at least weren't. And another question, I guess, related. You saw you shake your head, so I guess you answered that. But I guess a related question would be: were these gender specialists, these therapists, were they suggesting those additional options as well?
No, I mean, it was never brought up to me. I think mostly just because like I was a minor. But pretty much the whole process in my experience is completely patient led,
Hmm.
anyways, which is ridiculous because I mean,
Right.
there's not really any other course of treatment that's like that. And I was also a kid at the time, I mean, in my state, I'm from California. It's a misdemeanor to tattoo a child under the age of 18 or even to like let them
Right.
into a tanning booth.
Right.
I can't tan. I can't get a tattoo or a piercing without my parents signing off on it,
Right.
but I can make the choice to remove parts of my body and affect the entire course of my development from here on because I think I'm a boy.
Right. No, I mean
It's a ridiculous premise.
it is crazy. What now? But in your case, if your parents had not consented, would they have still? I don't know the laws in California. I think it's a current debate. I could be wrong, but you probably know what is if your parents say no, does that at least stop it, or can a minor go and get these transitions?
Yeah, I don't know if the laws have changed since then. Um, but at the time, like even within Kaiser, even within like my healthcare provider, like you needed to have a
Hmm.
parent, at least one parent, sign off on this to
Yeah,
allow a kid to go through it. Um,
I think
so
there's
I wouldn't
political
be able to
pushes now
consent
to.
these on my own.
There's definitely
But like I
political
said, like they
movements
coerced
to.
my parents.
Yeah, yeah, they coerce them
So it's not
through.
really consent, is it?
Right, and that's yeah, I agree, and that's what I want to remind people because again, I'm accused of vilifying parents, getting in the way of a parents and child's and doctor's decision. And what I point out is I'm like, look, my child might grow up to believe that it's normal to have one eye, and that she wants to identify that way. And by the way, having an eyeball, as important as it is actually less important than your reproductive organs. And if we took her to the doctor and said, look, she wants to identify as a one-eyed pirate, just like her dad, can you just remove an eye? There's a surgical intervention for that. Of course, we would be looked at like we're absolutely insane because you can't do that. But it's not, I'm not so sure. The only part the analogy actually fails is that I think an eye is simply less important than all of these other physiological attributes related
and
to reproduction.
Parents, right. And parents, no adult really has any right to do this to a kid. I don't think they do. I often hear people like utilizing like the parental rights and the government overstep argument. But I mean, the government already gets involved when a kid is being abused. That's why we have child protective services.
Of course.
And this is no different. It absolutely is a form of child abuse and neglect.
It is. Yeah, that's exactly the reasoning I would use. And I don't understand. One question I want to ask you is, what's your reaction to how politicized this is? Because it's very obviously a right versus left political issue. I don't even know where you are on the political spectrum. I don't know if you agree with me on taxes and gun control and all these other things. This shouldn't be. This is one of those issues where I'm not clear on why it's politicized at all and become a left-right issue. I looked at my colleagues, my Democrat colleagues, who I've worked with on many things, and they're treating me like I'm just the worst person imaginable for advocating against this stuff. And I'm like, I was called offensive because I called it a social contagion, and I'm like, look, there's a good reason I call it a social contagion. I mean, 5 years ago, 15,000 kids between 6 and 17 were diagnosed with gender dysphoria. Last year, it's 42,000. So there's clearly, for lack of a better term, a trend. And it's not because there's actually that many people born truly into the wrong body, right? There's clearly something of a social trend happening here and a social influence that's happening here. And we kind of talked at length about that. That's why I'm so interested in your story and understanding how that happens. But there's also studies that show you're far more likely to identify as transgender if you have peers who identify that way, right? It's not that different from any other kind of social trends that you embark upon, right? You dress a certain way, you act a certain way. It's all based on peer influence, and peer influence, means something very different to me as a teenager when I didn't have social media versus now. I mean, my first experience with Google was in 11th grade. So, your generation is growing up with a very, very different set of experiences with respect to what we would call peer influence. And it's magnified by times a million. And so there's clearly something social going on there. And how that's not obvious is strange. But back to my question is, what is your reaction to how politicized it is?
I mean, it makes me angry that it's so politicized, because it's so obviously not a political issue. It's a human issue. And I mean, people from all sorts of different beliefs, different walks of life, all believe that this is wrong, should never happen to kids, and that, I mean, we shouldn't be marking as kids or people who are incredibly mentally ill and not really capable of making a decision like this on their own responsibly. And it's something that's affecting entire families. It's tearing them and their children apart. It's infecting entire institutions such as healthcare and education, colleges and schools. It's something that everybody should be worried about, because we're all going to be affected by it in one way or another.
You feel in your detransition process, how's that been? So how does that even start? Did they try to talk you out of it? And how does that even work? Do you just start taking estrogen? I don't know.
Um, it was pretty difficult, especially in the initial few months in the first year. It was really rough because I stopped transitioning like right after my junior year of high school ended. Um, and the first steps I took were to grow my hair out, which I'd already been growing my hair out for some time, so it wasn't too difficult. Uh, I was buying new clothing. Um, and then the more difficult parts came of having to face the social ramifications and also my doctors. I had to admit to basically everybody in my life that this decision that I made and that I was so insistent on for years and that they were all pretty much a part of was wrong. And it was humiliating. And luckily, I didn't really get any pushback from anybody for the most part on my decision to detransition. But sometimes people were really mean about it. Like, I had people from school uh, who didn't necessarily know that I was a detransitioner, but maybe thought that like I was a trans woman. And I had a classmate of mine who I had a crush on in my senior year call me he, they, she, and he said it in a very demeaning way. Kind of broke my heart for a little bit. And then I had somebody message me online telling me that, well, I had a lot of people telling me that I was all my fault, that I should have known better, that I should take responsibility for my own actions. And then I had a person telling me that I looked better as a boy, basically encouraging me to retransition. Pretty disgusting stuff. And then once I went off the hormones, I had to like grapple with the hormonal imbalance and the lack of sex hormones in my body again. And I was very emotionally and psychologically unstable for it for a while. And it really affected pretty much all my relationships, especially at school. I lost all my friends. I went through my senior year basically completely alone. And people would say really awful things about me behind my back and sometimes to my face. Um, and
So the
I felt
the
like I really
friends
didn't really
who,
have anywhere to turn.
I mean, the friends who supported you, who knew about it, right?
Some of the
Like you
people who
said,
celebrated my mastectomy the most, once
yeah,
I talked about regret, they were like, "Oh no, it's all your fault. You should have known exactly what you're doing. You're harming the trans community by talking about this," they said.
wow,
Um, and my doctors were they were just as helpful. When I went back to my gender specialist, who referred me to surgery, one of the things she said was that, I mean, we're talking about this absolute failure of a treatment, right?
yeah,
And she tells me, it's just another part of your gender journey, whatever the hell that means. I mean,
yeah,
since when were kids supposed to go through a gender journey, right?
yeah,
I mean, it's not, it's not like would you tell a patient with cancer, uh, if if the course of their chemotherapy failed to stop the spread of their cancer, that it was just another part of their cancer journey? You wouldn't say
yeah,
that. I mean, it's so demeaning. Like just completely
yeah,
taking not only like her own responsibility, but also the seriousness of the situation of what happened to me away from it.
yeah,
And my endocrinologist, I went off testosterone cold turkey because I had absolutely no idea or any guidance on how to stop it.
hmm,
And I was supposed to get regular blood tests afterward. They stopped being scheduled after like two or so appointments. And my surgeon, I feel like I got the most evil response from him out of all of my doctors because uh, it was in August of last year that I went back to him to report like not only the regret of what I'd been through, but also like I'm having this serious complication with the skin grafts that they used,
yeah,
and got on like a 5 minute appointment with him over the phone, and he was like, "Oh yeah, well, I thought it was okay just because like you were referred to me by somebody else. I assume that they'd done all of the evaluation necessary, you know." Uh, and the weeping of the wounds, yeah, that's okay. Just put Vaseline on it to keep the wound moist or something. He said like the
But this is like a long
capillaries, the
time
blood
after the
vessels.
actual, this is a
Yeah,
long time
he said
after
that
surgery, right?
yeah,
I mean, how
he said that
long
the wound
after?
was still developing capillaries, so which should have been. I mean, I was told that like the healing would take maybe like would should be mostly done by like a year and a half afterward. This was more than 2 years afterward, and out of the blue, I start experiencing this awful complication that affects me every day, and he's just like completely dismissing my concerns. And the advice he gave me to put Vaseline on it gave me
Yeah.
a skin infection. And
Wow.
after I told him that, I reported back to him on that, but I couldn't bear to schedule another appointment because like how could I trust any doctor after they got me into the situation and then wouldn't help me out of it? How am I supposed to trust them with helping me?
Well, it just goes to show how experimental a lot of it is.
And
Um,
negligent.
negligent, experimental. I mean, it sounds like they treat you sort of like you're ordering fast food. Hey, you want fries? Oh yeah, we'll give you some fries. Okay. Oh, you don't like the fries? All right. I mean, what you want to order something else? Um, that's not healthcare though, right? That's not how healthcare is supposed to be delivered. Especially, and obviously it's an imperfect analogy because eating fries doesn't have a permanent effect on you. Well, maybe too much of it, sure, but it's just so far beyond, and you got a question, right? How do you think? I mean, you see the American Academy of Pediatrics, at least at the top levels, pushing this based on such limited data. I mean, it's such a disservice. It's such a betrayal to good pediatricians, good science, and but more importantly than anything, children, isn't it?
Absolutely. I mean, you hear that argument being thrown around a lot, that all of these major 3 to 5 letter organizations all agree that this should be done to children, that trans people actually are the sex that they identify as, and that the only approach we should take is to affirm them. Even though in other countries, especially the European countries that pioneered these treatments in children in the
Mhm.
first place, are rushing to pull back on this really quickly because, like,
Yeah.
they're in for quite a few lawsuits. Their findings are horrific, and yet the U.S. is going full force. And also, last month I was actually I was at the Endocrine Society convention, and I had a little booth there with Do No Harm, the nonprofit that I'm working as a senior fellow with, and I talked to quite a few endocrinologists from around the world, um, just about my story, and almost every single one of them was shocked and disgusted, and they had no idea that their own profession was doing this, and they were
Yeah.
absolutely against it.
Right.
So no, not all endocrinologists, not all doctors, not all of the major organizations agree that this should be performed on kids.
Yeah, and they send out very confusing messages. I mean, Endocrine Society in particular, correct me if I'm wrong, I thought the president had issued a statement about how great this stuff is, but their own actual research I guess it was the Endocrine Journal, and I'm getting this a little confused. There might be a difference between that and the society and this convention you're talking about, but I know one of the things that I had pointed out was, okay, the president said this, but their actual research says this, that they themselves published. um, how can this be
There's a
so
lot of that.
different? Yeah. How can this be so different? And it does seem that, like, once you get to that level of leading a society or whatever, like you said, like 5-letter organization, it becomes highly politicized, and they're for whatever reason captured by that extreme ideologies, that makes them say things they know not to be true, or at least you hope at least they know it. I mean, God, I look at some of the people attacking me for this, and I'm like, do you really? 5 minutes ago, you didn't believe in any of this. There's no way. Like this is a new belief you have all of a sudden. I question whether that is a sincerely held belief, just based on the evidence we have in front of. We all have the same access to the evidence. We all have brains, and so I don't know how you can make that statement so forcefully, and yet they do. And this has real effects on people who are susceptible to it, who don't know any better. Your parents are being told there's a 1% chance there's going to be regret. It's not true. No evidence to suggest it. It's terrifying. Um, what so I also, and the other thing we don't know. So in your case, you're going through that detransition. It's hard, but there's probably a point of no return also. I mean, you're only 18 now, right?
Yeah.
So you at least started that at a young age. Is there any science to tell us like what the point of no return is? I mean, you know, do you feel at least like you can get back to some sense of normalcy because you started early enough?
Um, I think I can, and I think that no matter what, no matter what's been taken from you, whether it be a part of your mind, a part of your body, or your or a few years out of your life, there's always life after detransition, or even just highly traumatic experiences in general. But some people are not as lucky as others, obviously. I mean, once after a certain amount of years on hormones, um, well, your body's not going to be able to produce sex hormones of its own in the necessary amount to stay healthy, and so you'll have to take supplemental sex hormones for the rest of your life, or after like the removal of the gonads, like the ovaries or the testicles, um, uh, after a few years on testosterone, like usually around like the 4 to 6 year mark, I would say the reproductive system has atrophied so much that a lot of these patients will have to unfortunately get like a hysterectomy, the removal
Mhm.
of the uterus. Um, and before, if you start on puberty blockers, before uh, certain stages in puberty, um, even if you even if you take those patients off of them, there's no guarantee that puberty is going to start up as normal, or that they're even going to fully develop sexually, that they'll be able to have children or even be capable of orgasm once they're an adult.
Yeah, and they don't
And of
know any of
course, you can't
this
reverse
at a young
the
age,
mastectomies or any of the genital surgeries.
right?
There's no bringing back breast tissue or restoring a neo-vagina into a penis or vice versa.
And kids can't possibly know this. I mean, I wouldn't suggest adults go through it either, but at least they're adults. And what's in your work with Do No Harm, you know, what are some of the stories you've encountered now that you're kind of doing this full time? I'm assume you see a lot. And so you go out, you speak to classrooms, you speak to kids about this. Tell me if I'm wrong, but that's what you do. And
Um,
like, what kind of stories do you hear back, and what kind of findings do y'all have in the sense of how often this is happening? Um, what are what are some of the worst, I guess, cases that you've seen? And do you think you're making progress in changing people's minds?
yeah, I mean, I do quite a few different things. I started with, and I still testify on legislation around this. Um, and I also do like speaking events. I recently did a speaking uh, event with Young America's Foundation.
Hmm.
I don't usually get to speak at like high schools or anything below colleges, unfortunately, just because I always get turned down. Um, but it's always nice to have those few times where I can actually speak to somebody around my age, the kids around my age or younger, because they're the ones who are mainly being affected by this. And I've met quite a few other people, um, both online and who have like come to testify or speak at events, who had been through transition and back, and the number is only growing. It's really terrifying, actually. I mean, the r/dtrans subreddit has roughly, I think, like 45,000 members, if not more, and they're rapidly growing. Um, and there's a bunch of detransitioners on platforms like Instagram and Twitter who are publicly or privately speaking about their experiences. And just within the past year or so, I've seen a rapid influx of people detransitioning and coming out about their stories.
Do you think how often do you think this happens? It's a bit of an open question. I don't know that we have perfect data. And I think we have, total numbers, like I recited a few earlier on a number of diagnoses of gender dysphoria. That's a different question than how often, doctors actually allow and take part in a surgical intervention on a minor. In your research and from your place at Do No Harm, I mean, how often do you think it happens? Do you guys have numbers on that?
I mean, we don't know yet, and we might not ever know all the numbers because, well, it's hard to go back to your doctors after going through all of this and regretting it. I mean, how could you trust them? How could you even look them in the eyes? I tried, I did it, and Kaiser actually did like a study of minors between the years 2013 to like 2021 or 2022, I think, and who regretted it. And I was not included in the study. They said that there was roughly like around 200 patients, 200 children who had their breasts removed, and only 2 were reported to have regret. And I didn't fill the criteria that those 2 people were. And I know several people who have had Kaiser as their provider, had double mastectomies as children, and it seems like none of them are included in that study either.
Right.
So there's no guarantee that these doctors will report their own malpractice. And I mean, the criteria for detransition and regret is also purposefully manipulated. And it's hard just to report or speak publicly about it.
Yeah, no, there's the stigma and you're attacked for it. And it's, you're very brave for doing it, because it's one thing for me to be attacked for it, right? It's a little different. It's a lot different. It's you're in politics, you better be ready for it. But it's quite different for an 18-year-old like yourself to actually, make this a cause. And it speaks to it speaks to your bravery on the subject. And you need people like you, because you're also very articulate about it, about educating people about the science and the terminology. And so it's a shame that you do get turned down at college campuses or high schools, because I mean, geez, this listening to your story should be required for anyone under 18 or over 18 for that matter, who's thinking about this, because knowledge is power, right? It's if you're going to take immense risk, you better really understand the benefits, first of all, if there are any, and the risks that you're actually taking, in a coherent way, just like with any medical intervention. And
I think everybody deserves to know.
They do, and the fact that it's silenced is a shame, which is why you and I are having this conversation to try and change that. And voices like yours are just incredibly powerful. And you could probably save a lot of lives by doing what you're doing. So
I hope so.
You should feel good about that. You should feel good about that for sure. How do people support Do No Harm? Tell us a little bit about the organization. Like, what's the website? Give us some contact info there.
Yeah. So Do No Harm is a nonprofit that's made up of physicians, patients, and parents. And this issue is our biggest focus right now. The issue of medically transitioning minors and everything that goes into that. And for the most part, sometimes I do events with them. For the most part, though, they mainly just help me with my travels between places, because I do travel a lot to testify on legislation and to speak at events on the subject. And it's been my focus for like about the past year or so.
Well, how can someone find them if they're listening right now? What's the website?
Sorry, I gotta make sure that I have the.
Yeah, let's get the exact one. And if they want to follow you on social media, donoharmmedicine.org. That's excellent. And I assume you have like a presence if you want to tell folks where to find you or how to ask you to speak or whatever it is. How can they find you?
Yeah, so I'm pretty active on social media. Twitter is my biggest platform, and I'm also on Instagram as well as YouTube, and it's all under the same username, at CHOOOCOLE. But you can
Okay,
also just find me by looking up Chloe Cole. So
we
my
cool.
username confuses people sometimes. So
Yeah, it's okay. It's social media. It is what it is. But luckily, this is a podcast, and they can rewind and write it down. So that's how they'll deal
or you
with
can put
it.
up like a little overlay.
Yeah, yeah. No, we will. We'll put it in the comment section as well.
Okay.
Or the whatever you call it. No, Chloe. I mean, I don't know if you have any last words. I think your story is incredibly powerful. Thanks for coming on and talking about this. Know that at least there's quite a few people fighting for the truth here, and that's the good news. The bad news is that it's like we talked about. It's become so politicized and so unnecessarily so. There's certain issues that's politics, right? It becomes tribal. Like if they're for it, we're against it, and I see the right do the same thing with some subjects as well. And it's like, hey guys, it's like, it's not about the color of the jersey you're wearing necessarily. You gotta speak from some sense of principle and some foundation, and that doesn't always
Right.
happen. But and this is how things get out of control, and we're certainly in a place where things have gotten out of control. But maybe this is maybe this is the pinnacle of that. Maybe it plateaus and declines from here. I think that's our hope, because it's clearly gone too far.
Right.
But
But I have
that's only
hope in the
because
world.
people like you fighting for it. So thank you, Chloe.
Thank you.
No, it's been great. Appreciate it.